medical consequences of addiction, from overdoses to liver disease, like hepatitis and even HIV. Here to discuss some of the long-term medical impacts from substance use disorders is our very own Dr. Henry Taylor from the Carroll County Health Department. Dr. Taylor.
Hey, Tim.
I'm really glad that you have come out, and we have worked together on and off through the years with my role at the State's Attorney's Office and just work in the community. So I'm really excited that you're here. And I think for this episode, we're talking about consequences.
Yep.
And one of the big consequences of substance use is medical. And so one of the things I wanted you to kind of just explain, like what, and I realize this is a wide open question, some of the consequences of long-term substance use.
Yeah, it gets into a long conversation, certainly, because when you think about the medical consequences of different substances, there are so many different ones, and each substance works in different ways. So I find it helpful to think about the organ systems, and a simpler response is almost what organ system is not affected by any particular substance. And frankly, that list is really, really short.
Yeah.
So alcohol, you think about that, certainly any of those that are suppressants works on your brain, works on your mind, the way you think. The alcohol goes down, you swallow it, you get ulcers, it changes the acidity. The liver has to work overtime to metabolize it. Then other substances that you might take in by mouth, then there might not be metabolized as much by the liver, but then by the kidneys. Obviously, when you start injecting things and breaking the skin, you open your body up to infection and the consequences of infection from scar tissue. And so the list, I can go on a long time, but pretty much any substance is going to have a pathway through the body. It's going to have its effects on the organ systems. And usually what's happening is either that organ's being driven faster than it needs to go or slower than it needs to go. And it results in inflammation and scarring and scar tissue. And from that, the organs then start to fail.
Yeah. One of the big things that I see from and hear from people in recovery and people that I work with in trying to help, from an overdose or situations like that, is a lot of people that use IV drugs are coming down with hepatitis C.
Absolutely.
And I think of it as a silent killer because you don't know about it until you go in to have blood work. One of the things I wanted to ask you, because I've heard this, is there are cures for that now for hepatitis C. Is that true? What would be, if someone was watching that is early in recovery or maybe thinking about getting in recovery and thinking, what's the use? I realize I have hepatitis C and I'm probably not going to live. What would be, if that's the mindset, and I realize that's right. Kind of far-fetched that maybe they're looking at it that way, but what would you suggest for them to do?
Yeah, well, certainly getting checked, because as you say, many of the infections that start developing through intravenous use or injections, the infections get into the tissue, get into the body, and we can fight those. So, but they can be silent. You may not know that you've been infected with HIV, hepatitis B, hepatitis C. Particularly hepatitis C, we're finding we have the opioid epidemic, but we have this epidemic of hepatitis C and a parallel epidemic of hepatitis A. But with hepatitis C, you get your blood tested. It's a very straightforward test. Joe was talking about part of his job is to do that testing. So peer counselors can do the testing. Your doctor's office can do it. It's available for free at most health departments. They'll work with you. And then there are programs, they need to be monitored because the drugs to treat hepatitis C, they'll stop the virus. They'll shut it down. They'll stop its activity and lower the levels. But they can have consequences too. So it's not just a pill you can pick up at the drugstore. It's something that needs to have medical monitoring, and they check, make sure you aren't getting side effects, watch your levels.
Yeah.
But yes, we can have cures on that. Same for HIV, you know, in the 1980s when I was just after I finished medical school and residency, that was kiss of death almost. And now there are many people who are very functional living with HIV, and I think the number of case reports, I think they're even suspecting there have been 3 people who have been cured of HIV, which we didn't think was possible.
Yeah.
So, you know, we're right in the middle of the pandemic now, but we have a lot we can do about viruses and protections we can take at many different levels. So the first thing, though, is getting aware of it, just like you said.
Yeah.
And then getting plugged into a system and then following through. And one thing you've helped me with at the health department and as a community-wide response is getting a healthcare system that cares about people and treats them properly. Because, and you know, my profession is not always, we'd like to do good, but we have these biases and we can be really off-putting and not supportive of people who've been traumatized or in the middle of addiction. The role for medicine is really to assist recovery. So your question to me beforehand was, you know, the medical consequences of addiction. It's easy to talk about the medical consequences of substances, but really for addiction, what's the effect of addiction on the person and the connections and how we rebuild our personhood after we've become addicted. And we need a sensitive system.
Yeah. We need more doctors like you.
Well,
because I've worked with you through the years, and you are very, you have a lot of compassion, and I've heard it. I hear it in your voice in a lot of the meetings that we do, and I really appreciate you. I appreciate all the work that you do in our county.
Yeah, but I'm a technical piece of a large team that includes the peers and, most importantly, the person in recovery.
Yeah.
I mean, that's we're a team. We're all in this together.
Yeah. And we have such a good community of people. Well, Dr. Taylor, I really appreciate you coming out, and I am just in awe of the work that you do. And we see each other lately just on a screen, so it's really nice to see you in person. And thank you very much for coming out.
Thanks. Appreciate it.
There are many medical consequences of addiction, and some people must deal with those effects even after they enter recovery. But there are also many new medications that can help treat these diseases, and in some cases, cure them altogether.